You're on.
Okay. Hi, good morning. I'm Jeff Vanzant, and I am a clinician with Wired Clinics. And I'm here today to talk to you about sexual addiction, assessment, and treatment. And I don't know if you heard the news this morning, but a big breakup in Hollywood. Demi Moore is divorcing Ashton Kutcher. So the cougar is, giving the kitten the boot here. And it seems like there might be some sexual addiction involved there. So, I'm going to talk to you today, but you don't have to be a Hollywood movie star to have sexual addiction. And some people even wonder, is there such a thing as sexual addiction? Is it a real diagnosis? So, as we talk today, I'm not going to be talking anything that's graphic or offensive to anybody. So, you just relax and learn, unless, if you have a sexual addiction, you might see yourself described up here. But otherwise, I want to tell you what sexual addiction is, how it operates in terms of debilitating somebody's life through what's called the sexual addiction cycle. And then I want to talk to you about how somebody gets out of that, and actually describe the steps of treatment and see how treatment is really different than counseling, where you're talking to somebody and they're just nodding back sometimes. Treatment is a very proactive way for somebody to get help with this disorder. So, is there really such a thing as sexual addiction, where somebody can be addicted? We know there's addiction to chemicals, where somebody is dependent upon a substance. Sexual addiction mirrors that, because people are getting a change in their brain chemistry. Dopamine levels, other kinds of endorphins are firing, and it really mirrors the kind of stimulus response that somebody has with a chemical addiction in a lot of ways. So, another way that just tells us, hey, this is a real dynamic in our culture, is that 12-step groups for sexual addicts have just multiplied. There's Sexaholics Anonymous, Sex Addicts Anonymous. There's COSA, which is a support group for people who spouses and partners of somebody who has an addiction. And whereas in 1991, there might have been about 2,000 of these groups in the U.S., I would guess in the state of Washington, there's probably about that many today. Well, 10% of people use the internet say, hey, I probably qualify as a cyber sex addict. I can't quit using the internet in a compulsive way, and it's really affecting my life. So 10% of people out there are actually self-confessed, self-acknowledged addicts when it comes to the internet. Okay, so how can somebody know if they have this? Are there some telltale signs? Are there some ways that really distinguish this, rather than just somebody pointing a finger and saying you might have this? Well, you can take the Pathos test. That's a quick little 7-step check to see, how has your sexual behavior affected you? And, if you're preoccupied, if you're ashamed, if you sought treatment before or tried to get some help, that might be a sign. If your sexual behavior has hurt someone you care about, and then, obviously, if you're sad, if you're having deep feelings, troubled feelings about your behavior, that's another sign. So we'll find there's 10 criteria that really define somebody who has sexual addiction. You don't have to have all 10, but really the threshold, the cutoff is if you have 3 of these criteria, it's a very strong likelihood you have compulsive addictive behavior. First being loss of control. This is just saying, well, I tended to be on the internet for 30 minutes. And you look up later and it's 3 hours later. In fact, it's not unusual for somebody with internet problems to spend anywhere from 5 to 20 hours a week on the internet for sexual purposes. So again, this is behavior. I'm doing something I didn't intend to do. Something got out of hand, time-wise, in terms of the extent I let it go to. Compulsive behavior. That's a pattern that's developed over time. And we really find that somebody reaches a point where there's really the point of no return. They're involved in something, triggered into a situation, and then they may want to stop, but the compulsion is too strong. So we just talked about efforts to stop. If somebody's doing something, they made some contract with themselves and said, hey, this is the last time, little promises that you've broken to your family members or yourself, and you tried and repeatedly had unsuccessful attempts to stop. Loss of time. Here we're talking about when really just the cost of spending too much time has taken away time from other areas of your life. So if we mentioned somebody gets on the internet 5 to 20 hours as being not untypical, that's neglecting time you could have spent on other things, and it's really starting to impact your time use. And people find themselves staying up late at night, poor performance at work. We'll talk about those other signs here in a minute. Preoccupation. This is when you're not really involved in a behavior, but you're thinking about it. You can't wait to get off work. You can't wait to go to the next situation where you're going to be in a sexual situation. And so it's dominating your, sexual addicts, 20% of them have had some kind of car accident or mishap because they're preoccupied with thinking and really just zoning in on that behavior. So they're obsessing is what they're doing. Inability to fulfill obligations. This is talking about family and work. A lot of times several people have been demoted or lost jobs over the period of their addiction. So they find out this is really not just impacting themselves, but having a ripple effect in their lives. Family and friends. Less time with parenting. Avoiding. If somebody's avoiding family obligations, social outings, that's another sign that they're caught up in something they can't stop. So here's one that really finds somebody. The consequences are starting to come, and yet people can't make a change. Separation, divorce. For females, it could be an abortion. Things that indicate there's loss happening in your life. Consequences can come in lots of ways. Loss of money. People spending a lot of money when they go to Las Vegas or somewhere that they didn't plan to spend. And of course, there are legal consequences, physical consequences, STDs. We can get into all different areas where the key theme that threads throughout here is that somebody's had loss in their life due to their behavior. Escalation is when you just can't get the same thrill at the same level. So you're going to increase the frequency or the amount, the quantity. And then we've already talked about losses some here. Oops, I'm going backwards here. Withdrawal. So there are withdrawal syndromes, just like with a drug, tolerance and withdrawal. Some people say it's harder to get off sexual addiction than heroin. So that's the addictive cycle. Let me run through this real briefly. It starts with belief system, where we don't really have confidence in ourselves. We got that from our family of origin. We have impaired thinking. Sex is my greatest need. Sex equals love. Then there's addiction cycle, and life becomes unmanageable. So the addiction cycle is when preoccupation leads to ritualization. I go to the same place, I'm driving by the same place every Friday night. Could be other kinds of ritualization to prepare for behaviors. That's compulsive behavior, and can lead to despair. And despair leads somebody to shame and guilt, and they're just in a spiral here where they just can't get out of it. So let's talk real quickly about how do you get out of sexual addiction. There's 7 tasks. You got to break denial. That doesn't happen easily. Sometimes it takes several weeks for somebody to do that. We have to understand addiction. So education is a big part of getting past sexual addiction. And all these are tasks that somebody accomplishes with a therapist and really works to achieve with homework assignments, that kind of thing. You have to limit the damage that's already taken place in your family. So there's first order boundaries and behaviors, fire drills you need to learn to avoid the behavior. But it's not all about avoidance. You have to establish sobriety and physical integrity. And finally, you don't do this by yourself. You really got to get a cultural support. That might be one of the 12-step groups or a church group. There's several today, Prodigals, Celebrate Recovery. There's a lot of groups that are designed to help somebody know that they don't have to walk through this alone. And some people even get sponsors, and they can do check-in calls. So there's a real time-tested, evidence-based approach to getting over sexual addiction. And that's my presentation. Any questions I can answer today?
Would you forgive me the mishap with this?
Sure.
I wanted to ask a little question.
Yeah.
When you're talking sexual addiction, you would generalize about all sorts of addictions or interpersonal. Let's say when the actual sex involved, or it's just, you know, like addiction to porn watching.
Anything that has a sex doesn't have to involve another person. It could be pornography. People are addicted to chat behaviors on Craigslist, and then they can't stop that. And even if they're not acting out with it, just the excitement of getting on Craigslist and exploring to who could I contact. And then, you know, that can be. So there could be addictions that involve other people, and then addictions that just involve yourself. Does that help there?
So we're not talking about potentially harmful or criminal behavior, or it's all included?
Okay, let me make, that's a good question. Sex addiction treatment is very separate than sex offender treatment. Sex offender when somebody's broken the law, child pornography, rape, other kinds of exhibitionism. That's kind of a gray area, but it's not a gray area with the law, but it is something that people can get help with. So that's an entire different training, that's an entire different treatment track. Sexual addictions are voluntary behavior with adults that are causing harmful behaviors but are not illegal per se. So that clarifies it.